variety of microphones I can use using different How about this one? Have you got sound now? How about this one? 212. Have you got? Has Instagram got sound? Instagram always works. I don't know. Oh yes, it's here. I have sound. So is it working now? Is it working now? It's working now. I don't think it's this microphone. I think it's that microphone on the webcam. Look at that. I've got all the tech working on Facebook. I've got the flipping top of the range. I've got this thing. It doesn't work. Right. Get rid of that. Should have just used the one that's on the microphone, on the webcam. Anyway. Good God. What is going on? Is it my microphone? Is it the connection at the back? Who knows? Anyway, let's not dwell. Thanks for letting me know. Can hear you on Instagram, not on Facebook. That Corinne is keeping up the numbers. She's watching on Instagram and Facebook. If everybody could do that, then we could double the numbers, guys. And I'd have, I'd be getting off for double figures on this. And, I think once you break double figures on these things, it just flies, apparently. But anyway, here we go. Let's do some questions because that's what we're all here for. Do you think having a breast lift with 125cc implants will help give them more fullness and not make them bigger? No, I don't think it will. I haven't got much information here because I don't know anything about this person. I don't know who's asked this question, and I don't know anything about their body and the shape of their body. When you look at implants, it's all about the width and the projection. It's not about the volume. However, having said that, 125 cc's is quite a small volume. And so I know that's going to be quite a small volume implant, and it's not going to be a very highly projecting implant because the volume is small. So even for a small person with a small base width, 125 cc's is not going to be a very highly projecting implant. And if you want more fullness, you want more projection of the implant. You want a higher profile implant. The first thing you've got to think about with an implant, well, not you've got to think about, the first thing I think about with an implant is the width of the implant. I measure the width of your chest, and then I'm looking for an implant of a certain width because it's got to fit your chest. It's got to fit your breast. Once you've got the width, then you look at the different projections for the width that will suit your frame. And then that brings it to a certain volume. So if you're saying I want more fullness, I'm thinking, okay, this is your width. Let's have a look at the more full implants. So maybe moderate, maybe high, maybe extra high. Depending on how much fullness you want. I can show you photos of the sort of different different looks you get. But because we have to fill the base width, the fuller the implant, the bigger it's going to be. So it doesn't really match if someone says, I want more fullness, but I don't want to be bigger. That's hard to do. And, if you don't want to be bigger, so this person's asking about a lift with implants, I would say to them, if you don't want them to be bigger, forget implants. Don't have any implants at all, because it's probably not going to give you what you want with your hijack egodosia. It's probably not going to give you what you want with your 125cc implant. And yet you're going to increase your risks, because when you add an implant to a lift, it increases the risks, because when you do a lift, it makes it all tight and you can get wound healing problems, infections. If the infection gets to the implant, you have to remove the implant. So a lift with implants is a big deal. So there's no point in taking on the extra risks, both short-term risks in terms of infections and delayed healing and wound problems, which would, as I say, require the implant to be removed, and long-term risks with implants, rippling, capsular contracture, ALCL, breast implant illness, all sorts of things that you can get with implants. I've got to be honest, they're all rare, so I don't want to put you off implants. But if you are borderline and thinking, shall I have an implant? I may just want a small one, 125cc one. I'm like, don't do it. Probably best not to do it. Probably best just to say, look, I tell you what, I'm just going to have a lift in the first instance. That sorts out the shape issue. However, we need to be fully informed. We need to have a proper conversation about what sort of shape can be achieved if you don't have an implant, because if you have a lift without an implant, it starts full and then it settles. It's fuller than it is now, so a lift makes them fuller than they are pre-op. it lifts them, obviously, and the clues in the title, but it settles. And it doesn't give what a lot of people in their mind think of when they think of fullness, because when they're in their mind, when they think of fullness, they think of someone with implants in who've got maybe a highly projecting implant, which has got quite a full look, and that cannot be achieved without an implant. The other thing people, when they look at a photo, has got to be careful. If you're looking at people with clothes on, they're all pushed up and all that. That is with clothes on and pushing them up. It's hard to get that sort of look without clothes on. You don't want them staying up there without clothes on. And if you do want them staying out there without clothes on, that is a higher projecting implant. So it's the projection of the implant that's important, married with the width, which we will measure in the clinic. But in general terms, a breast lift with implants, with 125 cc implants, I don't think that's going to give a huge amount of fullness, because at 125 cc's, knowing that it's got to fill the width of your breast, I don't know who you are and I don't know what the width of your chest is, but 125 cc is not a huge volume, so that's going to be quite a low profile implant. It's not going to be projecting very highly, and we want them because we need the width to fill the footprint of your breast. If it's too narrow, it doesn't fill the footprint, so we want it to fill the footprint of your breast. So we need that width, and if you're going to get the fullness to stay up here, you need that projection, so that will come with it a certain volume. So I do sometimes see people who say, I don't want to be any bigger, I just want a better shape and I want more fullness, thinking of having a lift with implants, because I've seen some photos and that's the sort of look I want. And that's always difficult, because I'm like, hold on a minute, lift with implants, you're going to be bigger. Implants are going to make them bigger. And if you want the implants not to make you bigger, if you want them for shape, difficult scenario. I need to do something about this. I need to do a blog post or even a web page on this, because it's quite a common question. But yeah, broadly speaking, my advice, what I'm sensing from this person is I'm going to say to them, just have a lift and accept they're not going to be as full as you want, but you haven't made them bigger, which is because you didn't want them bigger, and you haven't got the risks of implants. So it's a compromise. It's hate to say it, because it's thousands of pounds, the surgery, but it's a compromise. And you might say, I don't want to compromise. I want everything I have. You have to compromise, because if you have an implant, you have to be bigger than you want. And if you don't have an implant, you're going to have to be not as full as you want. So you have to compromise somewhere. It's not a question of I don't want to compromise. You have to compromise. Yeah. What's the English Seahawk got? Is a thyroid nodule removal available privately? Quite a long waiting list with NHS at the minute for my thyroid go to removal. Yes, it is the English Seahawk. Yeah, of course it is. Everything, the English Seahawk, everything. Am I right in saying that? Yeah, I would say, I pretty confidently say, everything is available privately. Well, actually, no, emergency treatment's not available privately, but elective stuff, yeah, thyroid, definitely, that's a massive one. So that'll be a general surgeon, that'll be an endocrine surgeon, thyroid surgeon who would do that. But faux show the English Seahawk. What you should do, phone up your local private hospital, say, I've got a thyroid nodule, I'm on the NHS waiting list. What's the, what's this schedule? How would I go about seeing whether I could have private treatment? But it's definitely available. That will be, as I say, it'll be a general surgeon. It wouldn't be someone like me. I'm a plastic surgeon, so I don't do that sort of thing. But it's definitely available privately for sure. Thanks for the question, by the way. Can you drink alcohol 2 days prior to having mastopexy with implants? What? Of course you can. Why would you not? Yeah, for sure. To be honest with you, alcohol's not that big a deal for me. Cigarettes, big deal, massive deal. Do not smoke, for goodness sake. Mastopexy with implants, but yeah, you're welcome, English Seahawk. Good luck with that. Yeah, just phone your private hospital and they'll hopefully they'll help you out. They should do. Yeah, alcohol, not a big problem with alcohol. Got a big problem with cigarettes. Cigarettes is an absolute nightmare. Mastopexy with implants and cigarettes, forget it. Don't do it. Don't have the surgery if you can't stop smoking. But drinking is not a problem at all. So obviously within reason. You don't want to. I was talking to someone about this the other day. You don't want to turn up to surgery drunk. Yes, it's happened to me. A patient turned up drunk. So if you've been drinking all night and you turn up drunk, we're probably going to cancel you. But you can have a glass of wine 2 days before the surgery, no problem at all. But within reason, alcohol is absolutely fine from a surgical point of view. If you're post-op and you're having painkillers, you've got to be a bit careful, because it can make you feel a bit squiffy. So you've got to be careful combining painkillers and alcohol. But 2 days prior, no problem at all. Do you have to use drains? when, do you have to use drains when having a tummy tuck? I had one when I had a C-section and they left it in for a few days and it killed me pulling it out. I can only imagine what it's like having a drain pulled out, and I imagine it's horrible. And no one likes drains. No one likes drains. And if I am with using fewer and fewer drains in general in plastic surgery, much fewer drains are being used. They used to be used for a lot more procedures than they are now. So, but tummy tuck is one of those ones I do use them. So the answer to the question is yes, I do use drains for a tummy tuck. In fact, that's not the question. The question was specifically, do you have to use drains when having a tummy tuck? So the answer to that question is no, you don't have to use drains when using a tummy tuck. And there are many surgeons who don't use drains, and the movement is away from using drains in tummy tucks. So fewer surgeons are using drains in tummy tucks. I am still one of the surgeons who is using drains in tummy tucks, but I myself am, I only leave them in for one night. And I'm doing quilting, so to sort of make the space smaller, to close the dead space. And I think the time will come when we stop using them, but I am still using them at the moment. But you don't have to use them. So if you didn't have a huge apron, you could have a discussion, and we could say, well, we could just do quilting and avoid drains. And that would certainly be an acceptable route to go down. You're not alone in disliking drains, for sure. Lucy Grice 43, I'm coming to see you next week after having my implants done by you 9 years ago. Weight gain and pregnancy has changed the look. Is it possible if I have it done again to have the same scar? Absolutely, Lucy Grice. What I would do, so assuming you just had implants, what I would do, Lucy, is I would actually excise your scar if I was putting implants in again, and give you a fresh scar in the same place. So it would kind of look like the same scar, but it would be a new scar, and your old scar, you certainly wouldn't have two scars if that's your question. You would have one scar in the same place, but I would excise your old scar, do the surgery, and then close up with a new scar. So I'll tell you now, Lucy, what I'll say to you in the clinic: weight gain and pregnancy. Number one, have you finished family? Number two, are you stable with your weight? So those things are important before you have any surgery. And then I guess what we're looking at is what we're going to do about sizes and stuff like that, whether we're going to go bigger or smaller, and whether we're going to do anything like lifts, whether the shape's an issue, or if it's just a size thing, or, well, that's the other thing, is why you, so it's changed a little, that's why you're having it done. There you go, you've written it there. So it'd be lovely to see you. 9 years post-op. What's happened in the last 9 years? Quite a lot, probably. So looking forward to catching up, Lucy. Looking forward to catching up. What's Yvette got? Yvette has got, hi, I'm female, age 47. I've had breast implants for 15 years under the muscle. Feels like old scar tissue has ripped from my chest as I've searing pain when bending or stooping over. Oof. Will an ultrasound show if there's a problem with the scar tissue? I've had no problems till now with them, thanks. No, it won't, Yvette. An ultrasound will show if there is, we'll be looking for the integrity of the implant to see if the implant is intact. If it's a problem with the scar tissue, then in fact, probably your first port of call of that, I would say, would be a surgeon, the original surgeon, if possible, if they're around 15 years. But the surgeon will be able to tell clinically if there's a problem with scar tissue around the area, around the implants, which does happen after time. So I would say an examination and a history with the surgeon will be your first port of call rather than a scan. Scans are things that we use to direct our treatment and help us make diagnosis. They don't really make a diagnosis on their own. A scan, you shouldn't really be using a scan to sort of make a diagnosis. You should be using a scan to confirm a diagnosis. So you should be saying, what are you looking for? And basically, scans are shadows. They're looking at different densities of tissues. So they can say, they can give you an idea if the implant's intact or not. They're not 100% on that, but they can give you a good idea whether the implant's intact. They can tell you whether there's fluid there or not. But they won't be able to tell you whether you've ripped the scar tissue. And they don't really tell you a great deal about the scar tissue. So I would say an appointment or a consultation with a plastic surgeon would be my advice on that one, rather than going straight to a scan. Because the other thing, you've got to look at what sort of scan are you looking at. So so you're talking about an ultrasound there, which is usually the first port of call, but depending on what they're looking for, they might suggest an MRI is better, which is a bit more advanced scan, a bit more invasive. Well, not invasive, but a bit more, an ultrasound is just a thing on there, whereas an MRI is a big sort of tunnel you go into. But a bit more of a bigger deal, I suppose, a bit more cost, but it might be better to delineate the anatomy better. So yeah, surgeon will be my first port of call on that one. How long does a tummy tuck with liposuction to the hips and flanks take? I'm scared of having a general anaesthetic. So it varies how long it takes, but I would say the sort of middle point of the curve is 3 hours. 3 hours is your bread and butter, I would say, for a tummy tuck with lipo to the hips and flanks. Probably half an hour or so. I've been hit by a sleep potion. Half an hour or so either side of that. So 2.5 to 3.5 hours is your sort of is your variance on that. Obviously, there's outliers. You might be 4 hours if it's a big one, but 2.5 to 3.5, 3 hours is a ballpark. That's for surgery time. You'll actually be off the ward for longer because you go down to theatre, you get prepped, you get draped. You have the surgery, then you get woken up in the anaesthetic room. So you're often off the ward for a good few hours. But the surgery itself is approximately 3 hours, give or take. Thank you. That's really informative. Thank you. Yeah, you're very welcome, Yvette. Good luck with that. Hope it's all well. Nice to see your Christmas picture up. Hope that hasn't been up all year. That's just gone up now for Christmas. So yeah, so 2.5 to 3.5 hours is how long it takes. I'm scared of having a general anaesthetic. You can have a tummy tuck with liposuction under local and sedation if you would prefer. That is an option. It's quite a big thing to have under local anaesthetic and sedation, to be honest with you. And my default position is general anaesthetic for this operation. But if you have got a fear of general, then you could have it under local and sedation. And what we often say to people is, look, see how you go. If you're uncomfortable, if it's too much for you, you can always convert to a general. To be honest, the local anaesthetic sedation is often quite deep, sort of verging on a general anaesthetic. So you're not actually awake when you have a local sedation. So it's a pretty deep sedation. So we could always have a discussion on what you're scared about with the local sedation, and you could talk to anaesthetists and stuff. But we could certainly do it under local sedation if you wish. But I would say to you, we might have to convert to G8 if it's a bit uncomfortable for you. Do we offer removal for a lymphoma located on the face? I think that's supposed to be lipoma rather than a lymphoma. Lymphoma is sort of a lymph node thing, blood disorder. But lipoma is like a fatty lump. So I think that's supposed to be a lipoma. Excuse me, moi. Yes. Yeah. Oh, yeah. Yeah, we'll take a lipoma off the face, of course. Take a lipoma off anywhere. Well, we had this last week, didn't we? Or the week before. I was on holiday last week, wasn't I? I think eyeball. I said we wouldn't take it off the eyeball. Don't think you can get a lipoma on the eyeball. But yeah, we'll take a lipoma off anywhere. And definitely the face, bread and butter, that is plastic surgeon. That's what we do. Definitely, yeah. Assuming it's lipoma. If it's lymphoma, then I think you need a bit more investigation. So if it is lymphoma, then I'll be like, hold on a minute. You need to see someone who's treating your lymphoma, and you often do different treatments rather than surgery for a lymphoma. But that's something to be discussed. If it's a lipoma, definitely yes. Do we offer breast fillers? Never mind, do we offer breast fillers? Do breast fillers exist? And the answer is no. Breast fillers don't exist. So no one offers breast fillers. Back in the day, there was one called Macrolane, which was like the face fillers you see, which is like little, face fillers is like 0.5 ml. This was one that you could inject in large volumes in the breast, but it had problems in terms of the potentially interfering with scans, that it could maybe make it difficult to see where breast cancers were. So I think that was the reason it was taken off the market. I never used it, but it was a temporary thing. So I guess it's a good idea to sort of try before you buy. But that's no longer on the market. So I'm not aware of any breast fillers that are on the market. So no, we don't offer any, and I don't think there are any. correct me if I'm wrong, if anyone knows of any breast fillers, but I've not heard of any. Well, not any currently on the market anyway. Does a breast lift include an areolar reduction? Yes. So a breast lift reduces the skin envelope of the breast, so it tightens the skin. And so often when people require a breast lift, that is because the skin has been stretched, classically through weight loss or pregnancy, and the areola is part of the skin, so the areola has also been stretched, and so the areola is sometimes a bit bigger than you would like. So you can you cut out the excess skin and you cut out the excess areola, so you can have a view if you want to have a certain diameter of areola. Certainly try and accommodate that. It's never an exact science, but even if you don't have a view on it, an areolar reduction is an integral part of a mastopexy, and which is a breast lift, and a breast reduction. It is an integral part. You don't have to ask for it. You don't have to pay or anything like that. It's just an integral part of a breast lift. Do we offer surgical drainage of fluid retention after liposuction? Brackets, surgery elsewhere, close brackets. No. No. I mean, it's a tricky one, this sort of stuff, this surgery elsewhere stuff. I mean, really, the problem is, from the patient's point of view, you probably think, oh, I just need a little bit of fluid aspiration. Once once I, as a doctor, take on a patient, do a bit of fluid aspiration or something, then you're kind of my patient. And you might think it's just a bit of fluid aspiration, but it really then it's like, oh, hold on, it's all wrinkly. Hold on, it's not all right. It's all, and then it's like, well, hold on a minute, I just did some fluid, or the fluid's come back again now. And so you sort of become my patient. So when you have a problem following a surgery, you really should look towards the surgeon, because looking after problems after surgery is part and parcel of doing surgery. The surgery that I do, the world that we are all in here, is the cosmetic world. And the cosmetic world, surgery is done on what's called a self-pay basis. Fixed price, sorry. So yes, it's self-pay. It's a fixed price package for surgery, which means you pay for the surgery and the aftercare is included. If you are, say, working in an insured world, so if you're doing hip replacements or hernias or thyroid operations or whatever, a lot of these operations are insured. And insured cases, you get paid as a surgeon every time you see the patient. Every time you do anything, you bill the insurance company. So every time you take blood, every time you drain a bit of liposuction fluid, every time you do any little minor revision or anything like that, you will get paid from the insurance company. The insurance company will pay for every procedure, every visit. And so it's a bit easier then to sort of get help from someone else, because they're going to get paid for every procedure that they do. In plastic surgery, it doesn't work like that. Plastic surgery, we only get paid for the first operation. It's self-pay, none of it's insured, so the patient pays, and we can't work on the same basis the insurance company works. We can't say it's £1,000 for this surgery, and then every time you see me, you have to pay £100. And if you get a problem, you have to pay to have the problem fixed, because people get cheesed off very quickly. Say, look, mate, you've made the problem. I'm not paying to have it fixed. You need to get it fixed. So that's how this world has evolved. So we then just front load the price. We say, okay, then we'll just charge you one price and we'll fix any problems, without making you pay. So that becomes very difficult when someone has a problem like this, because there isn't a format to say, yeah, I'll do an aspiration of your lymphoma, liposuction, and that'll be £100. That's the fee for that. And if it comes back, it'll be another £100. We don't have a fee for that, because if I do liposuction and there's fluid retention, I will just drain it, because it's part of the surgery. It's part of the surgery price. So we don't really have a fee to look after people who have had surgery elsewhere. There isn't a way that you can just slot into my practice, because all my fees are front loaded. We get paid a lot more than the other surgeons for the operations that we do. So the other surgeons look at us and say, hold on a minute, you get paid thousands of pounds for this operation. I'm only getting paid hundreds of pounds for my operation. We're like, yeah, but you get paid for every consultation. You get paid for every return to theatre, every time you see or touch that patient, you get paid again and again and again. We only get paid for that one operation. And we might have to see the patient again and again and operate them on again and again, potentially, and we don't get paid for any of that. So it's just the way it's distributed is slightly different in plastic surgery to other types of surgery, and for that reason, that is why if you have a problem, you will often be redirected back to your surgeon because they've got the aftercare package. You can't just come and see me, if you had surgery elsewhere, because we don't have a thing to say, right, some kind of price for the aftercare. The aftercare is free, inverted commas. It's included in the price of the surgery. So that's that's that. Is that Gabrielle Rebecca, are you in the UK? Yes, ma'am, I am. I'm in Birmingham. Well, actually, my wife says Worcestershire. She thinks that sounds better, but no one knows where Worcestershire is. But Birmingham, I'm practicing Birmingham, Edgbaston, right in the middle of the UK, in the Midlands. Yep. How about yourself, Gabrielle? Where are you? You in the UK? Anyway, yep, is the answer. I'm in the UK. Yep. Do we offer surgical? Done that one. Done that one. Apart from a tummy tuck, do we offer any other procedures for loose skin on the abdomen? No. That's one of the problems. I wish I did. Because I could serve my people better. Because for me, the only thing that I've got for a tummy tuck is a tummy tuck. That's the only. It's a tummy tuck or lose weight. That's it. A lot of people say, I just have a bit of liposuction. I don't find liposuction works well for the tummy. So there are different ways you can contour the tummy. Sort of tummy tuck is like the extreme, really. It's like the end game. Before that, there are things like liposuction. And the reason I don't like liposuction is it doesn't cause any skin retraction. And so you can get redundant skin and it doesn't look good. And I haven't had very good experiences with it. So therefore, I don't do it anymore. Now, there are some assisted forms of liposuction assisted with ultrasound, with laser, or with radio frequency, with some kind of energy. And the people who do that say that it causes some degree of skin retraction. So they do liposuction to the tummy. So that might be an option, an assisted form of liposuction, or the non-surgical liposculpture, or whatever you want to call it. It's like, again, radio frequency, cold or heat, or some kind of energy, basically. And the idea is that the energy is enough to kill the fat cells, but it doesn't kill the skin, because the fat cells are more susceptible to heat and cold and will die before the skin does. And so that's how they say that it causes some fat loss just by putting the sort of heating or cooling the skin or applying radio frequency. And again, they say that causes some skin retraction as well. So that's something you could think about if you have loose skin on your abdomen and it's not enough for a tummy tuck. Either an assisted form of liposuction or a non-surgical type of liposculpture with the heating or the radio frequency or the cooling. But I don't do any of them because I haven't seen great results from them, to be frank. That's why I don't do any of them. But maybe I'm not looking properly, so it's probably best to look for people who do it to make a judgment on whether it's worth it or not. We got some comments here. So yeah, so good question that, and wish I did, to be honest. Wish I did have something for tummy. It's apart from a tummy tuck, because not everyone's a candidate for a tummy tuck. Melissa Gilbert, what you got? Do you complete the surgery in Birmingham or do you have to go to London? Complete the surgery in Birmingham, Melissa. Oh, well, no, actually, sorry, retract that statement. The surgery at the moment, pretty much all my surgeries have been done in Liverpool, actually, not London, Liverpool. Simply because the private hospitals around here are not doing so much plastic surgery, because a lot of the NHS work is being done there. So I'm going to a place up in Liverpool to do a lot of the surgery. Everything before and after the surgery is done here in Birmingham, but the surgery itself is being done in Liverpool. I was up there this morning. Maybe that's why I'm yawning. Well, I was up there yesterday. Gabrielle is back. Gabrielle, Rebecca, what you got? How much do breast augmentations start at, and do you do payment options? I'm not far at all and very interested. Oh, we got ourselves a lead, guys. We got a lead. Don't lose it. Don't lose it. There we go. Looked into it and was told I needed 3,000 deposit to be considered for finance. Is the same with your company? Oh my God, Gabrielle, you're asking technical questions about the prices. Gabrielle, I've got to be honest. Full disclosure, no word of a lie. I don't know how much a breast augmentation is. You could say I should know, but I don't. I haven't got a clue. But I do know someone who does know. And what we can do, Gabrielle, is if you give me your email, I can, if you message me if you want, and I'll email you, or we can email you some information, or yeah, that's the best one. Or give us a ring or something, and they'll know. So the people at the clinic knows about it. I don't know about the finance thing. 3,000 deposit to be considered for finance. I think that being considered for finance is more about what your situation is rather than how much deposit you got. I would have thought, but I don't know. Anyway, yeah, but Amy, Nicola, Sally at the clinic will be helpful with that, and Amy will just know. She'll just say the price, bang, like that. But I've got to be honest with you, Gabrielle, I don't like talking about it. I feel a bit awkward about the money thing. I'm like, you know, I'll talk about all the surgery stuff, but the money thing is like not my arena. But if you somehow get message me your email address, or if you give us a ring, or if you drop us an email, info@staianoplasticsurgery.co.uk, we can email you back with some emails about breast augmentation, about what we offer and all that sort of stuff, prices, finance, etc. There you go. Drop me a message with my email, with your email. Do that, and we'll. Yeah. Sorry, I can't give you answers here and now, but I genuinely do not know. You know, not even I don't know prices for anything. Yeah, got enough to worry about, Gabrielle, without worrying about the prices. I tell you. Right then. So, thank you all for your commitment and your input this evening. Dark now, getting dark, isn't it? Used to be beautifully light at this time back in the summer time. Anyway, I've got to crack on then. Looking forward to see you all. Here we go. Melissa Gilbert's got something. I've seen some places offer tummy tucks without the drains. Is this safe? Yes, Melissa, it is safe to do a tummy tuck without drains. It is safe. I think it's quite established doing tummy tucks without drains. The reason I don't do tummy tucks without drains, and I'm moving that way, but the reason is because there's a space there, and the main thing I'm worried about is really seroma, to be honest with you, rather than hematoma. So the problems in the space is you can get blood collecting in the space, which is hematoma, or serous fluid, which is like wound fluid, which is seroma. Now the blood comes first, so the blood, when you first have the surgery, it can bleed and form a hematoma. Now, to be honest with you, if it's bleeding enough to form a hematoma, having a drain there is probably not going to stop a hematoma. So you can still get hematoma with a drain in. It just comes out through the drain, and it still balloons up, and you get a hematoma. The main reason that I think drains are good is they're suction drains, so they suck it and they suck the space down. So that what can happen with a tummy tuck is a week or so afterwards, you can get some wound fluid collecting in the space. And that's called a seroma. It sloshes about. It's a bit of a nuisance. Sometimes you have to put a needle in and drain it. So it's a bit of a nuisance. It's not a disaster, to be honest with you, but it's a bit of a nuisance. And the people who do the drainless tummy tucks say, look, it's not too bad. The rate's not too bad. It's like 8% sort of figure is quoted. And I'm like, I've had one seroma that I can remember in my life, really. God. I probably had more, but it's not that common for me to get a seroma. That one, I remember that one because it was Christmas. Can you believe it? Christmas. I think it was actually Christmas Day. I had to go to the hospital and drain the seroma. But anyway, but it's rare in my practice. This is going back. This is before I had the clinic, so I think it's before I had the clinic. So it must be over 10 years ago. Anyway, it's rare in my practice. Is the point? So I don't want to start getting more seromas. So I would still say it's safe, but it's just got, in my view, a slightly higher risk of getting a seroma than when you use drains. And as I say, the drains only stay in overnight. I only leave them one night, suck those two space together, and I believe that it's better. But as I say, I'm using quilting stitches now, probably going to move away from drains. But in answer to your question, Melissa, it is safe to use them. There are very good plastic surgeons who are safe to not use drains, who are not using drains. It doesn't mean that they're not safe. They are safe. That's fine. I'll drop you a message. What's going on? What's Elaine got? Is it worth getting my implants checked? They're 7 years old. I know my body has changed, but I think there might be a change to one implant. One feels higher than the other and possibly slightly denser. Definitely, Elaine. I say definitely, not in a bad way. I won't worry about it. But Elaine, always lovely to see you. Of course. Come on, we'll have a look. Get it checked out. No harm done. What you're saying, I'm kind of thinking it sounds like there might be a little bit of early capsular contracture, where you're saying one feels a bit denser, feels a bit higher. When they get capsular contracture, it feels looks a bit fuller. Even if it's like a moderate profile, it can look like a high profile because it contracts around it and it makes it into a bit more of a ball. So what you're describing there sounds like capsular contracture. Totally nothing to worry about. Totally doesn't need any treatment at all. Can be progressive. And if it does progress and get worse, it can be treated by removing the implants, removing the capsule, putting new ones in again. But at the moment, it's, if it's not too bad, it's nothing to worry about. But I always say to people, look, just come. I offer everybody a yearly checkup. I'm sure I've offered you a yearly checkup, but whether or not you take it, just come if you've got a problem. Always worth getting checked out, and always happy to see you. But as I say, from what you're saying, it sounds a bit like capsular contracture. But anyway, I would be very happy to see you to confirm. Bev, what are you up to? Probably my time. Probably my time, Bev. It's your time, Bev. It's your time to shine. No pain. No other issue other than what I feel, see. What's probably your time? Is it, you mean the seroma? The seroma, Bev, was a patient who, I remember it very clearly, it was Spire Parkway, and it was Christmas, and I remember Parkway was closed. I remember phoning. So hospital's closed, everything's gone to Little Aston. So I had to go to Little Aston. I remember driving up to Little Aston. I'm pretty sure it's Christmas Day, driving to Little Aston on Christmas Day. And I had to meet the patient there to drain the seroma. So if it was the seroma you mean about, probably your time, I don't know, maybe something else. Elaine, what you got? No pain, no other issues other than what I feel or see. Yeah, you know what, Elaine? It's always best to, pop in, give us a ring, get on the blower, message me, whatever. We'll sort you out. Well, it'll be nice to see you. Always good. I'm good. Yes, when I work with you. Yeah, no, it was Parkway, Bev. It was Parkway, and / Little Aston was. Why did I have a seroma? So maybe I've had more than one if it was one with you. All right, there you go. Maybe it was. Anyway, they're not common seromas. Do you recommend MLD after lipo? MLD, I'm going to go with manual lymphatic drainage. What else could it be? Come on. I don't recommend it, yoga compression garments. I don't recommend it. That doesn't mean that I don't recommend it. That makes sense, doesn't it? No, I mean, I don't not recommend it. Yeah. I just don't recommend it. No, I mean, I'll be honest with you, yoga compression garments, I don't know enough about it. Full disclosure. I've had patients who have had it and said it's good. I think the principle of it sounds good. And I think even if, I don't want to upset any MLD people out there, but even if it's just like a massage, it's going to be helpful. And maybe it does encourage lymphatic drainage and etc. and swelling and what have you. And I'm sure, I'm sure it is a good thing. And maybe I should be looking in. I don't know any. Do you do it? Do you know someone who does it? Let me know if you do it, or let me know. Maybe I should be sort of linked with someone and offer that to my patients, because I'm open to it. I'm open to it. And if my patients say, "What do you think about MLD?" I'm like, "Well, yeah, I've had patients who said it's good. You can try it if you want," type thing. But I don't sort of recommend it. I don't know if there's any evidence, from a scientific point of view. I don't know if they've got sort of 100 patients and done 50 with MLD and 50, or like half the body with MLD, half not, and said, look at the improvement, a real proper randomized controlled trial. But there's a lot of stuff, to be honest with you, that there's no evidence for. But if it it's not going to do any harm and patients say it's good, I'm open to it. Yes, I will send you. So send me some information, yoga compression garments, and maybe get some yoga compression garments along with it. Very good. Yeah. Melissa, dog ears. Does everyone get these? And do you need surgery again to fix these? No, Melissa, not everybody gets them at all. Hardly anyone gets them. Well, not hardly anyone. It's one of the more common complications with any surgery when you're cutting stuff out. When you're cutting stuff out and stitching it up, you can get bump at the end of the scar. You get rivet by making the scar longer, and always try to make the scar as short as possible. So it is always a risk with surgery, especially stuff like tummy tucks, breast lifts, Mastopexy, facelifts, things like that. There's always risks of dog ears, but not everyone gets them, and they usually settle, to be honest with you. But if they don't settle, they're pretty easy to fix, to be honest with you, Melissa. I won't worry too much about it. It's usually local anaesthetic. You just cut them out, make the scar a bit longer. A relatively simple fix, so don't worry too much about it. But no, I wouldn't. No way everyone gets them. Yvette, what you got? For you do checkups for older implants you haven't personally implanted, and what would the checkup involve, please? Again, Yvette, a bit like, I mean, immediate complications not really. You're welcome, Melissa. Immediate complications not really open to taking that on. People with the older implants, yes, happy to see you. To be honest with you, Yvette, again, always say go to your original surgeon, because they're going to charge. If you see me, I will charge you if I haven't put your implants in myself. If I have put your implants in myself, absolutely fine, see you, no problem. But if I haven't, I will charge you. But the main problem you're going to get is usually noted by the patient, and it's usually hardening. You know, hardening and a difference in shape, and that's capsular contracture. Also things like lumps and swellings, and you need to get them checked out. So if you come and see me, the checkup involves a history and an examination, and that's what most people, that's all they need. History being talking to you, what's the problem, what are your symptoms. Examining you means feel it. If you've got a lump, if you've got a swelling, is the main thing I'm thinking, is that lump implant or is that lump breast? Because if the lump is breast, you need to get it checked out. So I'll refer you back to the GP, get a breast surgeon to see you, because that's something you need to get looked at. If it's implant, that's fine. It's a hardening of the implant, capsular contracture, perhaps. You know, that's talk to you about what it is. Well, I'll talk to you now about what it is, save you a consultation. It's hardening of the implant. Scar tissue forms around the implant, tends to get worse over time and can be treated by removing the capsule, putting a new implant in again. But it's quite a big operation, quite traumatic, creates more scar tissue. So another capsule comes quicker second time around. So you're always best leaving it as long as you can. But it's that sort of discussion about just seeing how your implants feel, see if there's any problems with them, and talking to you about whether there's any need for treatment. If there is specific issues like specific lumps, swellings, things like that, as I say, you might need referral, you might need imaging, scans, what have you. Personally, I don't routinely scan people with implants in. So I don't routinely scan people because, as I said earlier, a scan is really looking for a problem. If clinically there's nothing that you've got to look for, I wouldn't routinely scan. I'd only scan if there was a concern. So yeah, it's a history and examination is what the checkup involves in short, I guess. Look at this, Bev, one of the nicest surgeons ever. Who are you talking about, Bev? Look at that. Now, thanks, Bev. Jolly good of you to say so. Now, Kay Kaif has sent a video request to join. I think that's probably a mistake. It's usually a mistake when people do that on Instagram. I've got to be honest, I've done it myself. When you are on Instagram, if you accidentally press it, it says join with them. So I'm going to ignore that, Kay Kaif. But if you do want to join me on the video, just say, and I will accept your request. But if I accept it, I will end up in your living room. So just be warned. I'm just going to leave that on there. But Bev, there you go. Bev thinks I'm one of the nicest surgeons ever. That's very kind of you to say that, Bev. That means a lot. Thank you very much. I hope you're all right, Bev. I hope everything's going all right with you. We've all split up, haven't we? Used to be there, Priory and everything. Yvette, no lumps, no swelling, no hardening, as far as I'm aware, but a 2.5-year wait to see an NHS surgeon in my area. Yeah, I mean, to be honest with you, Yvette, you could see a GP but actually a GP is not going to do a routine thing. But yeah, I mean, it was a mistake. Yeah, okay. Yeah, if you haven't got any problems, I think you're probably all right. But if you do want to see someone, yeah, unfortunately, if you can't see your original surgeon, you will have to pay to see someone like me. But your original surgeon might see you. But yeah, but if you haven't got any problems, you maybe don't need to see anyone. If you have got problems, I would start with your GP, and then if you've got a problem with your breast, then they'll get you in on a expedite you. It won't be a 2.5-year wait. But yeah, GP might be an issue. It might be an option. Gabrielle, emailed all my info over to the email and got price. So next step is consultation. Bloody hell, look at that for service. That is service. While I'm on the thing, I've replied. That is, look at that. Wow. That's it. I hope you're impressed, Gabrielle. That will email you back straight away. That is impressive. Shauna, hi. Sorry if you've already covered this. Do surgeries have to be covered out in Liverpool, or can I have it done at your Birmingham clinic? I haven't really covered it, Shauna. It depends on what the surgery is. My Birmingham clinic is only for local anaesthetic. So if you've got a dog ear, if you've got a mole, if you've got a cyst, if you've got a split earlobe, if you've got an inverted nipple, if you've got a tattoo, if you've got a lipoma or something that needs to be cut out, then I can do all that stuff under local anaesthetic at my clinic in Birmingham. If you need a general anaesthetic or local anaesthetic with sedation for a bigger operation, tummy tuck, breast lift, breast implants, mummy makeover, whatever. Anyway, all the other major surgery, bigger surgery. Oh, here we go, breast implants. So yeah, Liverpool, breast implants, all that stuff is done in Liverpool. So yeah, the surgery's done in Liverpool. The follow-up before and after is done here in Birmingham, but the surgery's done in Liverpool. It's not too bad actually, Shauna. It's an hour 45 for me. I'm just south of Birmingham, so it's not actually too bad, but it's just the most stable theatres that I can get, really. So that's why I'm pretty much doing everything there now. Gabrielle, it's unreal. Already feel like my mind has been made up and your team will be doing the surgery. Wow. That's good, Gabrielle. That's nice to hear. Look at that. Got ourselves a patient. What's his request? Oh, still okay. I'm going to ignore that. That's kind, Gabrielle. Well, we're looking forward to seeing you, and we'll look after you. Don't you worry. Shauna, breast implants. Yeah, that's great. So Shauna, breast implants would be surgery in Liverpool, but everything else before and after surgery is done at Birmingham. Okay. That's a bit of a flurry there. Good. Thank you very much for your input and your questions. I will go and put my feet up if that's okay. And I will be here next week, will I? Am I on holiday? I think holiday's finished now, isn't it? The holidays are gone. It's back to work now, isn't it? Corinne, great to have you back. My Tuesday evenings are complete again. Look at that, Corinne. Oh, that's kind, Corinne. Yeah, I am back now. Holiday season is finished. Mind you, we've got October half term coming up, so we've got something to look forward to. But until then, it's a Tuesday extravaganza every week. So I will see you all next week. Love you big time. Have a good evening. Live long and prosper. Stop the stream.